Now, 101 health centers will be retrofitted as part of the Ministry of Health's Hurricane Response Program. The facilities, which are mainly in Western Jamaica, will also be reclassified to meet the needs of the communities and offer new services. Jamila Maitland reports.
101 health centers, 1 hospital, 5 parishes. The Health Hurricane Response Program, being funded by the government to the tune of $6 billion, is expected to transform primary health care for communities, especially those hardest hit by Hurricane Melissa.
3 engineering firms that have gone out and are doing technical assessment of these facilities. Some of them will be abandoned. Some of them will be totally different from what they are. And we're now doing some drawings and estimates and all that sort of technical stuff.
41 health centers are to be reformed. Currently, health centers are classified as Type 1 to Type 5 and provides varying services. The health centers will be reclassified into 3 categories: community, district, and comprehensive. Chief Medical Officer Dr. Jacqueline Bisesa-McKenzie explains.
A lot of persons have lost their faith in the health centers because they say, I go there, there's no doctor there. And so they bypass the health centers, and where it is that a doctor comes, if the doctor comes once a week or twice a month or something like that. And so there is no reliability.
As a result, the CMO says the hospitals, already bursting at the seams with treating emergencies and other traumas, become overwhelmed with primary healthcare issues. Program Director Karen Mackenzie Chin says communities will have greater access to certain services at health centers.
The expanded services at the different health centers will include for maternal and child health, as how the systems were generally understood to provide, but it will also now include for dental services at a lot of their institutions, ensuring that we have mental health for both adults and for the adolescents and children, as well as the integration of diagnostic services at the health centers.
Assessments have already been done on 100 health centers. In Beeston Spring, however, a remote rural community in eastern Westmoreland, there appears to be a challenge. The Ministry of Health didn't reveal all the details, only that the assessments will be done. Meanwhile, the Savanna-la-Mar Hospital, that also sustained major infrastructural damage during Hurricane Melissa, will also be upgraded.
Or we'll be building a new accident and emergency building. We'll be improving on the outpatient and the physiotherapy services. We'll also be purchasing additional equipment to ensure that the service delivery is improved.
Jamila Maitland, TVJ News.